WSNY and WSNY HD Columbus.
Welcome to Dentally Speaking with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, and groundbreaking research. Our show is also known as everything you've always wanted to know about dentistry, but we're too numb to ask. I'm General Dentist Dr. Brian Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the other great shows that previously aired, log on to dentallyspeaking.com or iTunes, keywords Dr. Kvitko or Dentally Speaking. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for Dentally Speaking with Dr. Kvitko to discuss your dental issues. Now, here's your host.
You're one of the people that are staying home and not going at all. And for those of you that do go on a regular basis, you're definitely going to see the difference if you take note of these 20 things. Now, because it's 20, we're going to have to do it in 2 shows. So this is part 1. We'll bring you part 2 in about 2 to 3 weeks. All right? But before I get started, the office, something I'm not sure the details. I don't mean a tragedy in the sense of somebody was hurt or anything like that, but they're just scrambling and just don't have the time. So we're really, really in need. If you're a dentist or you know a dentist, please have them call 262-9588 and let my office staff know that you're available. Okay? That'd be awesome. All right. If you would like to watch the show, you can go. All right. Here's the thing. I thought about this because I've had several people lately tell me about how much more comfortable their visit was when I numbed them compared to where their previous dentist had been numbing them. And even in the case of the hygienist I was filling in for a dentist. Well, it was this patient needed to be seen. He couldn't see her, so I saw her. And she's very nervous. She was actually crying because she didn't want anyone else in her mouth, but the other guy was gone. So she let me be her dentist that day. And so I assured her I'd be gentle. And I was talking to the hygienist beforehand. I said, okay, where are your 30-gauge short needles? She goes, what? I said, where are the 30-gauge shorts? And she said, I don't know what you're talking about. I says, well, they come in a blue little plastic thing, get some of these needles. And so when I numbed the patient, she was like, you're kidding. You've numbed me? What did you just do? Did you numb me? And I said, yeah. She goes, no, you didn't. I go, yes, I did. I just numbed you. She goes, wow. And he's been sticking me with that other thing all these years? So she went from feeling like he was more gentle than me, or assuming he was, to where she realized with this little trick, it was so much different. So one of the biggest things you can take from today's show is what you need to do. Ask your dentist to use a 30-gauge needle. Typically, we buy 30-gauge shorts. I don't even know if they make 30-gauge longs. I'll have to look into that. But the typical one is 27. And by the way, when you're talking about gauge, the higher the number, the smaller it is. Same thing with wire. 20-gauge wire is tiny compared to like a 10-gauge wire. Okay? So remember that. The other one, so that's number 1. The other one I've already mentioned kind of accidentally, and that is topical anesthetic. Make sure your dentist is using topical anesthetic, not just numbing you, but the topical. Now, what that is, it's either a gel or a spray, and you put it on the gum in the area before we're going to numb the patient, and it numbs it 3 or 4 cell layers, thick, just enough so that when we actually put the needle in, you don't feel that, or at least not very much. Okay, so that's very important. I mean, that's super important. Okay. The other thing is when I do my numbing, I do it very, very slow, very deliberate, just barely piercing tissue and just holding my hand as steady as I can. And these are things you're going to want to ask your dentist to do. I don't like the stab and jab technique. There are dentists say, oh, you just stick them in, it only hurts for a second. I'm going, yeah, but it only hurts them for a second. I mean, what if it hurt you for a second? Is that what you would want? So, topical anesthetic, 30-gauge short needle. Now, I'm going to tell you some of these tips I'm going to give you today. They might actually upset your dentist that you're being so succinct or distinct with your requests. They're going to say, oh, gee, now I got to go buy 30-gauge short needles. But you know what? They have to buy needles anyway. If half of them are 30-gauge and half of them are 27, what's the big deal? They just buy half and half. So Definitely do this. And if they give you a hassle or they say, well, we don't have those, you know, you might want to think about saying, well, I can either come back, doc, after you've purchased them, or you might consider an office that already uses them. Okay? I hope I don't get angry phone calls from other dentists, but it's possible. You just never know. All right, now here's an important one. I think this is very, very important because remember, I'm talking about your comfort and what can you do. So here's the thing. If you're going to have multiple fillings or you're going to have multiple crowns, basically if you're going to have multiple teeth worked on at the same time, one of the things that is tricky for us as dentists is to get the bite adjusted just right so that when your teeth touch just like they did when you walked in the door as you leave. Okay, so we want to make sure that all the teeth that touched when you walked in are the same teeth that touch when you walk out, because if it's not like that, then you're going to get soreness somewhere, either in the teeth that are hitting too hard, or in your jaw, or some other ways. Hot sensitivity, cold sensitivity, because if you traumatize a tooth by hitting it too often or too hard, it gets hot and cold sensitive. Okay, so here's what you do. We dentists like to do 4 or 5 teeth in a row, and there is absolutely nothing wrong with that. Prepare them all at the same, numb them all at the same time, prepare them all at the same time. But when it comes to filling them, I'm saying find a dentist that will fill one and then adjust the bite so that you know that tooth is not hitting any different than it was when you walked in the door, and then fill the next one and adjust the bite for the same reason. Because if you fill all 4 and then go back to adjust the bite, it can be really tricky. Because guess what? You think the front tooth is fine because you don't see any of those blue marks when you do the tap, tap, tap paper, the blue paper. But the reason you didn't see any marks is because the back tooth was too thick. So you adjust the back tooth and you think you got the back tooth fine. What you don't realize is now the front tooth is touching because you thought it wasn't. It wasn't before, but now it is because you've adjusted the back tooth. So you're going to be better off if your dentist adjusts fills the tooth, make sure the bite's right before he or she goes on to the next one. Remember, it's your comfort we're worried about, not the dentist's. All right, now there's some interesting things here. One of the things that I hear the most, I would say, is people saying how those x-rays are not very comfortable. Those x-rays, they poke me, my mouth is too small, it makes me gag, makes me bleed, I have bony things that are in the way, and I just hate those x-rays. And then guess what happens? Because I don't know if you know this, but I used to teach at the College of Dentistry. I taught radiology. I taught how to take the x-rays, how to read them to both dental hygiene students and dental students. All right? So then I'm called into the room because my hygienist is having trouble getting the films or my dental assistant is having trouble getting the films. And so what I do is I go in and I take the x-rays. And they go, fine, now how can I do them when someone else can't? The biggest reason is I use a technique. There's 2 ways of taking x-rays. What's called paralleling and bisecting the angle. The paralleling version has these little devices, these plastic holders. They're called RIN devices, R-I-N-N. And there's a little block that goes in your mouth, and it has a little arm that sticks out with a little round collar that helps us align the round cone. Well, that's an easier method to learn, but not as comfortable for the patient in most instances. And at the dental school, we used to teach the other method primarily, which was bisecting the angle. Bisecting the angle is very, very comfortable for patients. Very comfortable. I can do a bisecting the angle on almost anyone without them having discomfort. And by the way, if I do have somebody that they're having issues with the x-rays, it's making them gag or it's just too uncomfortable, I'll actually numb them so that I can get great x-rays. That's something else you should tell your dentist. If it's too bad, you just don't think this is going to work, say, can you numb me? And if they're not willing to numb you, you might want to find somebody that is. All right? And by the way, that's probably going to be tip number 21 because that wasn't on my list, being numb. But here's the thing. Find a dentist that will either numb you or knows how to do bisecting the angle. Bisecting the angle is kinder to tissue, kinder to the patient, but harder to learn. And most practitioners these days don't know how to do it, or they forgot how to do it. So, but you should find somebody that can do it for you. All right. So, looks like it's time to do Dr. Kvitko's question of the day. So remember what we've talked about so far. We've talked about asking for 30-gauge needles. We've talked about asking for topical anesthetic. And we've talked about making sure that you have each filling adjusted one at a time before the dentist goes on to the next. All right, so let's go ahead. Before we do Dr. Kvitko's question, though, we want you to listen to this.
This station will not be held liable for any contesting during Dentally Speaking with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household, prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
I was scared of dentists in the dark. I was scared of dentists in the dark.
And now it's time for Dr. Kvitko's question of the day.
And let me remind you that you're going to win free flowers from Weistember Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call is 459-9769, but let me give you the question first. Which of the following is a good way to make your dental appointments more comfortable? Okay? A, ask your dentist to use a topical anesthetic before numbing you. B, ask your dentist to use a 30-gauge needle when numbing you. C, when having multiple fillings or crowns done at one time, ask your dentist to finish one tooth and adjust its bite before going on to the next tooth. Or D, all of the above. All right, the winner receives free flowers from Weistember Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call, 459-9769. So go ahead and call now.
Stay tuned to Dentally Speaking with Dr. Kvitko.
At Dr. Kvitko & Associates, a lot of people ask us if we're accepting new patients. They know we've been in business for 34 years and assume we're not. Well, guess what? They're wrong. We do accept new patients. After all, if we're doing our job correctly, we get our patients healthy, so all they need are routine exams, cleanings, and the occasional filling or two. That leaves us free to take care of you. So yes, we do take new patients, and we would love to take care of you, your family, and your friends. Give us a call at 614-262-9588 or go to drkvitko.com.
Dentally Speaking is his talk show. Dr. Kvitko. Let's go!
Hi, I'm Johanna, and I've been a dental patient at Dr. Kvitko & Associates for over 10 years. I would really recommend Dr. Kvitko for your family's dental care. They're friendly. They're always there to help me. I feel like family when I walk in the door. It's clean, it's comfortable. Even if I have to bring my kids, they have a great playroom for them. I know when I'm with Dr. Kvitko, they are taking that extra time to make sure that I'm going to be the healthiest I can be. They've been great. I love them.
Call Dr. Kvitko & Associates today, 614-262-9588.
State ascoltando Dentally Speaking con il dottor Kvitko, qui sulla vostra radio preferita.
I bought a toothbrush, some toothpaste, a flannel for my face, pajamas, a hairbrush, new shoes, and a case. I said to my reflection.
All right, we're back. We're doing Dr. Kvitko's question of the day. The question was, it was about, okay, which of the following is a good way to make your dental appointments more comfortable? And A was ask your dentist to use a topical anesthetic before numbing you. B, ask your dentist to use a 30-gauge needle when numbing you. C, when having multiple fillings or crowns done at one time, ask your dentist to finish one tooth, adjust its bite before going on to the next tooth. Or D, all of the above. And Edith was our winner this morning, but we've had some phone troubles. We've lost her. So Edith, if you would like to call back, we'll get your information. Anyway, so Edith had the correct answer, which was D, all of the above. All right, so now let's get back to the topic. I think I mentioned it, but let me just dwell on it a little more. The numbing, being numbed slowly. So even if you're not doing the stab and jab technique, when you numb somebody, even if you put the needle in kind of slow at first, you still need to inject the liquid very slow, because the liquid can build up pressure really fast, and that causes pain in and of itself, okay? So that would be, again, ask your dentist if they are the type that injects slowly, and we'll use those needles that we talked about. Do you remember what it was? 30 gauge. All right, don't forget that. It'll definitely help you in the future. Okay, now there are some that you may not think of that will make your visit more comfortable. Here's another one. It would be, use the restroom before you sit in the dental chair. I actually had a woman in the chair last week, and I said, "Are you okay?" She goes, "I'm fine." And I kind of sensed that she was a little tense. And when I sensed that, I think I might have hurt them. I think I might have, maybe they're feeling it and they're just not telling me because they figure they can sit still and they don't want to be a complainer. So I said, "Well, no, you seem tense." She goes, "Well, actually, I need to use the restroom." So she goes, "I thought I could hold it, but I don't think I can." So see, we stopped and we let her use the restroom. She should have just said, "I need to use the restroom," so then she could be more relaxed in the dental chair for what we were doing. So make sure you don't have to use the restroom while you're in the dental chair. That is 1, 2, 3, 4, 5. That was our 6th out of 10 that we're going to cover today. Here's another. If it's hard for you to open your mouth or keep it open, ask for a mouth prop. We actually call it a tooth pillow. It's not really a pillow, but it actually can work that way, because if you're physically trying to open your mouth and hold it that way, it makes your muscles tired. If we put this little prop in your mouth, this a wedge-shaped piece of plastic, we put it in your mouth and it holds you open, you can just rest on it. You're just letting your mouth go. You're not having to actually try. So that goes a long, long way. And you'd be amazed. See, in my early years, I thought, I don't know, should I use the mouth prop? Because I'm going to think the people are going to think it's like a torture device. But what I've learned is it's not. It's actually, I'm doing them a big favor by using the mouth prop. Okay. Now, another one would be, excuse me, don't schedule anything right before or right after your appointment. Why? Because it stresses you out. If you have something that you're doing right before and you're rushing in the door, you've probably heard the phrase, if you're already late if you're on time. If you come on time, you're already late because you're not really prepared, whether it's for a meeting at work or for your child's choir concert. If you walk in when the thing starts, you're probably disrupting the room. So, and especially this, people will come in all the time and they'll say, "Well, when are we going to be done?" And I say, "I don't know, we have you down for an hour, so I guess that'll be 9. And they go, "Oh, well, I have to be somewhere at 9. Or I have to be somewhere at 9:10, which would be okay if I finished at 9. But if I finished at 9:03, well, now I'm making them late. And they're going to be upset, so they're going to be sitting there all stressed out the whole visit. And if you are stressed, then your visit will, I promise you, it just isn't as comfortable as it could be. Okay, so remember that one. That's important too. Now, this other one is, well, I'm trying to find out which would be the coolest ones. Okay, here's another one. I think I just kind of covered it. Come to your appointment on time, because that's kind of tied in. That's the one I was looking for. If you come late, I'm not going to do it. I'm not going to change anything I do. If you come late, you come at 9:05 for 9 o'clock appointment, and it's an hour long, I'm still going to get you done, but it's going to be 10:05. I'm not going to try to rush to get your hour appointment done in 55 minutes, because I might have to take a shortcut. I might be too rough, and we don't want to do that. So if you come on time, then your dentist can relax, you can relax, everything should go well. But if you come late, and guess what? We have a lot of people, they come late, and they say, "Oh, by the way, I have a hair appointment right afterwards, so I need to be out 5 minutes early." So now they're trying to take my 60 minutes of dental care and condense it into 50 minutes, and everybody's stressed. Okay? You don't want everybody stressed in the room, right? And let's see here. It's almost time to go to a break. Let me see. We've covered 1, 2, 3, 4, 5, 6, 7, 8, 9 of the 20 things that I said we'd be covering today. So I think what we'll do is we'll go ahead and we'll go to a break now. And when we come back, we're going to have my Why in the World segment, and we'll give you the 10th thing that you can do to make sure your dental appointment is more comfortable. We'll be right back.
This is Clark Kellogg. Stay tuned for more of Dentally Speaking with Dr. Kvitko.
ただいまあなたのお気に入りの番組からドクタークビッコのデンタリースピーキングをお送りしています。
Here at Dr. Kvitko and Associates, we are intensely dedicated to providing the absolute best dental care. The word mediocre isn't in our vocabulary. We just won't take shortcuts. Isn't that what you want in the person you trust with sharp objects in your mouth? Of course it is. However, people tend to assume high quality means expensive. But guess what? We're more affordable than you think. Our fees are about the same as one of those chains. But with us, you get our 34 years of experience and our unwavering commitment to quality. Discover for yourself. Call us at 614-262-9588.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the Dentally Speaking show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now or send an email to Dr. Kvitko at AOL.com.
When it comes to the overall health of your teeth, trust the experience of Dr. Kvitko and Associates. From dental cleanings and exams to restoration, dental implants, and pediatric care, Dr. Kvitko and Associates can give you something to smile about.
There's a lot of places out there that offer discount dentistry, but at Dr. Kvitko's, he actually takes the time.
See what Dr. Kvitko and Associates can do for you. Conveniently located on High Street in Clintonville, call 262-9588 or online at drkvitko.com.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
Tell her make me a grill. I might be grilled out nicely in my white tee on South Beach. When I open up your mouth, your grill gleaming. I stand up, let me see your grill. Let you see my what? Yeah, your grill.
All right, we're back. This is Dentally Speaking. I'm Dr. Kvitko. Thank you so much for joining me. What we're doing today is we're covering the top 20 things you can do to make your dental appointments more comfortable. Things that you can do. Now, in some cases, it means you have to ask your dentist to do it for you, but it's things that you can do and sometimes won't happen unless you speak up. And I'll tell you what, I'm going to recap the ones that we've already mentioned. We've mentioned if it's hard to hold your mouth open, ask your dentist to use a mouth prop. 2 was use the restroom before you sit in the dental chair, because if you're holding it during your appointment, you're going to be stressed and fidgety. If you're fidgety, your dentist will have to start and stop a lot. 3, don't schedule anything right before or after your appointment so that you're not stressed and the dentist isn't stressed. The next one was bisect the angle of the x-rays. Okay, so a different technique for taking x-rays. If your x-rays are uncomfortable, ask your dentist or hygienist or assistant to use the bisecting the angle technique. If they don't know how to do it, you might want to come back when they do or find somebody that does. Showing up on time, because if you don't show up on time, dentist is stressed, you're stressed, and it's not going to go as well. Asking your dentist to use a topical anesthetic before he or she numbs you is very important. And probably one of the biggest things is asking your dentist to use a 30-gauge short needle, because those are so small, you can hardly feel them, especially when compared to the one that most dentists use, which is a 27-gauge, which is a fatter bore. Okay? You don't want that. And then we've talked about asking your dentist to adjust the bite on each filling one at a time before going on to the next, so that you can be sure that the teeth come together the way you walked in the door. They come together the same way when you walk out the door. And getting numbed slowly. Make sure they're willing to numb you very slowly, because even if you didn't feel the needle, if they're injecting the liquid and they inject it too fast, well, then you get this rush of fluid kind of causing almost like an instant blister, and the pressure of that fluid puts pressure on the pain nerve endings in the area. All right, so that was that I believe was 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. And let me see. Here's one. This one just came up, so we'll make this number 10, which may be the last one we have time for this week, because we're going to do a follow-up and do part 2. The other 10 will be in probably in 2 weeks or 3. Let me think. Next week we're going to have a show about the Dentistry from the Heart event that we are held on June 12th. The following week will be an interview with the president of the American Dental Association, Dr. Maxine Feinberg. And so it'll be the week after that. So 3 weeks from now is when we'll have part 2 of this. So be sure to mark it down, tune in, so you can get all 20 recommendations for making your dental appointments more comfortable. But this is the one that came up last week. I had a new patient. She had gone to an office that she needed a tooth extracted, and they didn't feel comfortable that they could do the extraction. So they said, well, you need to go to an oral surgeon. She knew that I did extractions as well, because we are kind of a one-stop shop, and I've been doing extractions for 35 years. And she says I was closer and a little bit cheaper than the oral surgeon. So she came, and she goes, I got to warn you that my heart always races after I get numbed. And, I know it goes away, but it's still upsetting, and I'll be okay, but I just wanted to tell you it's going to stress me out. And I said, well, wait a minute. It goes away in a few minutes? She goes, yeah. And I says, well, that's just from the anesthetic. In the anesthetic, there is epinephrine, which is essentially adrenaline. I said, we have other anesthetics. We have anesthetics that don't have epinephrine in them. And then there's another one that has another vasoconstrictor that's not epinephrine, but it will actually constrict the vessels. So I said, let me just use that on you. She goes, does it work? I said, yeah, it works. I said, the only thing that you can tell different is that maybe it doesn't keep people numb quite as long. But first of all, no big deal. We just give you more. And secondly, taking out her tooth was not going to take me so long that it would wear off. So she said, okay, let's do it. And I did it, and I got a couple comments from her, all positive. First thing she says was, did you just numb me? Because I didn't even feel it, because I was using that same technique we talked about. The other was, she goes, I didn't get that rush. I didn't get that fidgety feeling. This is great. She goes, I wonder why they didn't use that years ago. So she left very, very happy, and she was very complimentary. And I basically just told her that, it's that's the way it should be wherever she goes. And if she goes somewhere where they don't have that anesthetic, just like maybe ask them to go buy it or something. All right. So, and just to recap, that was asking for the anesthetic that does not have a vasoconstrictor. It's called carbocaine 3%. Carbocaine 3%. So this leads me to my why in the world segment. It's kind of a simple one. It's why in the world would you go to a dentist that hurts you or doesn't make your appointments as pleasant as they can? To me, it's just crazy, because there's no reason that dental appointments have to be unpleasant at all, period. I mean, just at all. It's there's so many things that we can do, and you're going to learn the other 10 in a few weeks when we do the other part 2 of this show. But I think too many people are just, they're afraid to speak up. I had a girl who, somebody else did porcelain veneers on her front teeth to like do a smile makeover. And I remember when I first saw it, I didn't like it, but she liked it. She seemed to like it. She was saying she liked it. And so I kept my mouth shut. But what happened was, in a couple of visits, like about a year and a half later, she started to cry, and I said, what's wrong? And she says, you know what? I don't really like my front teeth. I was just afraid to say something. And I go, well, just so you know, I didn't like them either, so we're on the same page. So my point, and we went and we fixed everything up for her. It took us a couple of visits. We got them all reshaped and shortened, and everything's cool now. She was just in last week. We talked about it, kind of reminisced. So anyway, speak up, go to a different office, come to me if you want. You don't have to. I can't treat everybody in Central Ohio, but I do do a good job for those who come. All right. So I think that is all of our time. And don't forget to follow me on Twitter. It's at Dr. Kvitko. Visit my dental office Facebook page and like us. That would be awesome. And next week, the show will be interviews from my Dentist from the Heart and free healthcare event. Week after that, interview with the American Dental Association. And after that, president of the American Dental Association. After that, part 2 of this show. And so be sure to join me next Sunday and every Sunday morning right here on your favorite station. Goodbye.
Before we leave, let me tell y'all a little something. Before we leave, let me tell y'all a little something.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week for another exciting episode of Dentally Speaking with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to dentallyspeaking.com to access full episodes of Dr. Kvitko's show.
If you would like to book Dr. Kvitko to speak at your next event, please call 614-262-9588. That's 614-262-9588. Or send an email to Dr. Kvitko at dentallyspeaking.com. That's DRKVITKO at dentallyspeaking.com.
WSNY and